Hey there, this is Dr. Tall Paul Simon, psychiatrist. Please subscribe to this YouTube channel so that I can keep making all these videos and improve their quality. This video is about alcohol use problems. People wonder, oh gosh, do I have a problem with alcohol? What is considered an alcohol use disorder? What is alcoholism? What is alcohol dependence or abuse and all these things? And what can be done about it? So just wanted to touch base with you about all these kind of things. Alcohol trouble is pretty common. It's dangerous, can kill you, or make your life more complicated, if not miserable. But it can be treated and addressed. So there is hope. So um, alcoholism is a term that gets thrown around very loosely, but also, on the other hand, not loosely enough. So what is considered a normal amount of alcohol? Okay, so normal amount of alcohol depends on who you ask to some degree. Now, for example, the World Health Organization, big places like that would say there's no safe amount of alcohol, period. It's like, okay, well, that's not a realistic goal for most people, at least a lot of people in different cultures. So what is considered a safe amount of alcohol? So it depends on males versus females and your body composition, these things. Now, for some people, the smaller you are, the more the alcohol concentration you'll have in your body. So for males, it's considered 7 to 14 12-ounce beer equivalents in a week's time total, and no more than 3 to 5 in one go. Beyond that, according to studies, the chances of the person having alcohol-related problems with family relationships or job problems or health problems all start to increase on that graph. So as far as with females, it's a little lower. So no more than 7 is considered safe in a week's time for females, and no more than 3 in one go in one evening or whatever. So it's definitely less for females. Now, another caveat to that with females of childbearing age, any amount of alcohol in pregnancy is associated with um, birth defects and stuff. So there is no safe amount of alcohol if there's a chance that you may be or become pregnant. So that's one thing. Now, where beyond that, as far as the amount, where does it become a problem with alcohol? So it's considered a problem is if it's causing you problems in your life. Okay, so you don't have to drink every day to be considered having an alcohol use disorder. All right, so people have that misconception. It can be one night. Somebody has a real problem with alcohol. Let's say they get drunk and do something stupid, and they get a DUI or get into a fight, um, and that happens more than once. Then if there's a pattern there, one night, okay, people make mistakes, but if there's a pattern of repeated doing stupid stuff, maybe people confronting you saying you need to cut down, or you're getting annoyed at people saying, hey, you need to rein it in, or you're drinking in the morning to try to get a little eye opener there, or help with any hair of the dog, so to say, or hangover, or if you feel guilty about your use, if you're kind of ashamed, say, oh man, I really need to cut back, and it's starting to cause you concern, any of those are kind of warning signs. Now, um, so if alcohol is like a problem in your life, it can start to interfere with the different roles that you have in your life. So think about your different roles in your life. So yeah, employer, employee, husband or wife, or sibling or partner, or neighbor or driver, any of these things, any of these different roles that we have in life. If it's starting to interfere in those things, then it's crossing a line somewhere. So if it's interfering with relationships, or If it's impacting your ability to go places because, okay, you just had a few beers and now, you really shouldn't drive. So you can't go somewhere. And let's say you need to be somewhere, that's interfering with that role. So it's not as much a matter of the amount of drinking or how drunk you feel. It's more about whether the alcohol is interfering in your life in some way. And that can just be in relationships. So if the people around you are concerned or somebody's expressing concern repeatedly, say, hey, you need to rein it in. That's a red flag. You need to listen to the people that care about you enough to say that. Um, out of respect for the relationship and that person, you say, okay, yeah, maybe I need to think about this and maybe rein it in. So now, going back to what's considered a safe amount of alcohol, one important point is that for some people, no amount of alcohol is safe. If you have a strong family history of alcoholism, if you've struggled controlling the amount of the alcohol that you consume, maybe you just shouldn't drink at all, and what's so bad about that? Nothing, you save money and stay out of trouble, and you don't have to worry about the risk of drinking if you don't drink. So it's an option not to drink. Now, some people run into the problem and say, well, gosh, everybody I know drinks, my whole family, all my friends, my social life is built on drinking. And that can be a real issue, but you can be brave. You're a tough person, tougher than you think. Sometimes people just need to make that difficult choice, sometimes of what places they want to go or people that they want to associate with. If perhaps everybody past 10 o'clock at a family gathering are intoxicated, well, maybe you need to leave at 9, and that's okay. And if people give you a hard time about it, well, that's on them, honestly. And that's a tough spot to be in, but you can do it. You're able to do it. Um, as far as what can be done about alcoholism or alcohol use disorders, there are different things you can do. So there are two ways to quit any addiction is suddenly or gradually. So if, let's say, you have a heart attack or some kind of health crisis or DUI, pretty important to quit suddenly. But withdrawals can be dangerous with alcohol. If you have a lot of tolerance to alcohol, you get the shakes and sweats, and it can be even worse than that in some people. It can be life-threatening, in fact, to stop alcohol suddenly. So that's where sometimes physicians or doctors need to come in and help people wean off essentially the alcohol using different medications. So when you're trying to address alcohol use problems, there's the first part of it where people are drying out. That's the scary part for some people because the withdrawals can be dangerous. So the drying out period is, usually lasts a week or so, sometimes a little more, depending on the person, sometimes a little less, depends on how bad it is. There are medications such as lorazepam, um, clonazepam, Librium. There's a lot of different benzodiazepines. That's a type of medication that is used for withdrawal. Sometimes we use anti-seizure medications to help with the withdrawal. And then there are medications that can also help with to reduce the cravings or the urges to drink. So those would be like Revia or naltrexone. There's Camprol, acamprosate. There's other ones out there. One is called disulfiram or Antabuse, which if you take and you even smell alcohol with, cooking stuff or Scope mouthwash or something like that, it'll make you really sick. So that one is not used as much because people won't take it. If you get miserably, horribly sick, if you even look at alcohol, who's going to take that medicine? So nobody. That's not really the standard of care. The standard of care for alcoholism, as far as medications, is the detox medication and then the maintenance medication. So what I use, especially on the outpatient setting, is actually a medication called gabapentin. Gabapentin is used for seizures, sometimes for anxiety a little bit. It's much less addictive than a benzodiazepine. and it can help with the withdrawals, the shakes, the sweats, and that kind of stuff. But it's also used beyond that to kind of take the edge off the nerves so that people don't have that itch to drink. Then you take that with the naltrexone after a week of being dry, and that naltrexone can take it once a day, um, can help with the cravings and things. So the goal for an alcohol use problem is, really complete sobriety. Now, not everybody shares that goal, and you have to, start where the person's at. If that's not your goal, just to, moderate the drinking. Okay, I think most physicians, most clinicians would work with you as best you can, but at some point that you might have to realize that that's not a reasonable goal because it's just exposing yourself to trouble or potential risk. So alcohol use disorders can be treated medically. I think of them almost as like a food allergy. All right. So like the gluten intolerance and all these different things that people are much more aware of nowadays. Well, consider alcoholism or alcohol use disorder kind of a food allergy. Just it's not good for you. Maybe it affects you mentally or emotionally or physically. Just it's just not good for you. So some people just say you're allergic to it. People wonder why you're not drinking anymore and say, well, gosh, I got an allergy to it and I just started getting really sick and vomiting all over, but just whatever. And then people stop asking, if you make up something really disgusting. So, um, but yeah, it can be treated. Now, as far as counseling and therapy and rehab and all that kind of stuff, those are good, especially in the short term to help people maybe think about what changes they need to make in their life, and help develop the skills that they need that maybe they're compensating for with alcohol. Now, I've never met somebody who really struggled with alcohol who didn't have an anxiety problem. You know, so a lot of times anxiety and depression may be underlying the alcohol use issue, and that needs to be addressed. So with the uncovering of the person, getting rid of the alcohol and say, okay, where are we at? Where are we at in life? Do we have a social life outside of alcohol? Do we have any hobbies? Do we have anything that really brings us meaning and joy outside of a setting that includes alcohol? And if the answer is not really, so okay, you got some work to do. So pull up your pants and we got to work on this stuff. Um, Sleep issues is another real problem, another real barrier that people run into, especially with withdrawals. Now that gets better with time on its own, but it can take months. Now, so in the short term, people who struggle with the sleep issues relating to alcohol and stuff, the one medicine that I use is called mirtazapine or Remeron. It's actually kind of a unique antidepressant, but can make people really tired and help with sleep. So it can address the anxiety, depression, but also the sleep all in one go. Now, some people also use trazodone, which is an SSRI, kind of like Prozac, but it's not a great antidepressant anxiety medication, but it can help with sleep and it's not addictive. So it's a good option there. But I prefer mirtazapine or Remeron. I think it works a little bit better for most people. Thiamine, a vitamin called thiamine, sometimes gets very low with too much drinking. So it's important if somebody's been drinking pretty heavily for a while to take a thiamine over the counter every day to kind of replete that. As far as going back to the counseling and stuff like that, the most proven long-term means that people use for sobriety is actually Alcoholics Anonymous. Now, it's um, a worldwide organization. It's free. The key with that is number one, finding a home group and finding a sponsor. Okay. Home group is a regular group that you go to regularly and you get along with those people and you just connect with them pretty well and use that as your foundation. And then you can supplement with other groups around, like let's say you're traveling out of town, you can go to a group locally. And there's a 24-hour hotline that they have for Alcoholics Anonymous where you can find a local meeting wherever you're at and get to it. Sometimes people will have to go to multiple meetings a day to fill up their time and just get that support before they're really dry. And a sponsor is somebody who has been dry for at least a couple years and have worked through the steps in AA, and somebody that you can call anytime to try to, be there for you, in that. And they've been there. And so they know that you know what we're struggling with there. The inpatient rehabs and all that kind of stuff, those are actually not as effective for a lot of people, and they're very expensive. So um, they can help, they can get the ball rolling, but the long-term plan, AA, the one hang up with that is that, there's an element of faith to it, non-denominational faith. It's monotheistic kind of thing. There's a theme of giving over your control to that higher power. Some people don't like that concept, or it's a barrier there. I encourage people to just try to look past that for their own benefit for the time being, and maybe look for an alternative while you're doing that. But if you need all the help you can get, if it's not 100% fit for you, hey, take what you can get in the short term and go from there. There's no time, time's a waste, and let's do this. Okay, so you can do it. There's treatment out there. It's um, it's a condition that people get after exposure to this toxic substance called alcohol. There is a genetic component to it. People are susceptible to it more than others, um, but it can be treated. There's hope. And please reach out and find that help. Start with a physician or a therapist, or call AA. Ask for help because it's out there, but you got to find it. Nobody's going to be banging on your door, hopefully. So please subscribe to this channel, and hope you guys are doing okay. Take care.